Good evening, and good evening. This is Nurse Eunice with Florida Training Academy. And in tonight's video, we're going to cover 50 practice questions to help you pass your CNA exam. And as we do in every video, we'll give you about 10 seconds to receive your notifications, and we will get started shortly. Hi, everybody. All right, let us begin. Question number one. Oh, hi, Nonsense. All right, so let's give our instructions first. So, our instructions state that the practice questions that we're reviewing today, because I received this question a whole bunch, are the questions good for all states? Yes, it's based off of just general knowledge. It is not state specific, so you can use any of our videos to help you pass our state examination. If there is something that is specific to Florida, the state that I'm located in, I will say that in the video. So each of the questions we're covering tonight includes 4 answer choices. You would select the best of 4. So usually there's one correct answer for each question. And your goal for tonight, I want you to score yourself and to see if you score higher than 80%. So 50 questions on the test, and let's get started. And Charlo called me and she said, Nurse Eunice, you've not been online in 2 weeks. And so we've had a lot going on, but Charlo, this video is for you. And 242 Mama, I am so proud of you. It says, I want to tell you how much I appreciate you and your videos. I took the skills and the CNA exam on the 19th and I passed. Congratulations. That is right. So let's help a few more others pass. And so 242 Mama, I thank you and I appreciate you and I wish you much success with your CNA and your nursing career. All right, let's get it going, everybody. All right, so our first scenario is about Maria. She is a CNA working in a long-term care facility, and she's assigned to assist Mr. Thompson, a resident with a weakened immune system. While helping him with personal care, Maria notices that another CNA enters the room without washing her hands after assisting a different resident. Later, Maria needs to help another resident in the dining room. What is the most effective way Maria can prevent the spread of infection in this situation? Is it A, wear gloves at all times while assisting residents, even when not providing direct care? B, perform proper hand hygiene before and after assisting each resident? C, use alcohol wipes to disinfect all surfaces in the resident's room? Or D, keep Mr. Thompson's door closed at all times to reduce exposure. And I see there are a lot of comments in the chat area. I may have to go back and review. But right now I want to practice. I want to make sure we get these questions in. Sorry it's been so long since I've been online, everybody. And looks like the team has it. The team has B. And hold up, I just saw a wonderful comment. Let's see. Stephanie passed her exam also. Oh my God, congratulations. All right, so here we go, everybody. It is B. You have that. While gloves are essential for certain tasks, they do not replace hand hygiene. So the most effective way to prevent the transmission of germs is through proper hand washing with warm water soap. You can also use hand sanitizer whenever appropriate. All right, let's go to our next one, everybody. Question number 2. The resident with hemiparesis needs to be dressed. What should the CNA do first? Is it A, start with the weak side? B, start with the strong side? C, dress both sides at the same time? Or D, allow the resident to dress independently? So hemi means half, paresis, weakness, tingling, numbness. So half of this person's body is weak. What are you going to dress first? All right, so it looks like Faye and Zanib and Game and Lois and Miss Allen. And we have Jess who says that she passed her test too. I'm so proud of you all. Everybody says A. So let's see in 3, 2, and 1. You have it. And so this is an image of a patient with hemiparesis. So one part of his body is weaker than the other. And so whenever you are going to help someone get dressed, you help them dress the weak part first. Because remember, they can assist with the strong part of their bodies. They don't need much help from you. So you help with the weak and then allow them as much independence as possible where they can dress themselves safely. All right, let's see. Oh, thank you so much, Danita. So, Nurse Eunice, I want to thank you for all your help. I'm a registered CNA. Congratulations. And my nurse examiner asked what she can suggest for some of the students that can't pass her test. And I told her, Nurse Eunice, girl, thank you so much. And Samantha takes her test tomorrow. So, good luck, Samantha. Question number 3. When assisting a resident to transfer from bed to wheelchair, the CNA should. Is it A, place the wheelchair on the resident's weaker side, B, hold the resident under the arms for support, C, lock the brakes and use a gait belt, or D, allow the resident to pull up on the CNA's neck? Well, D sounds painful and dangerous, so we know it is not D. All right, we're going to reveal the answer in 3, 2, and yes, everybody, we can't fool you. We are going to lock those brakes. That is the priority, patient safety. So locking the brakes ensures safety, and using a gait belt helps to stabilize and support the resident during the transfer. All right, question number 4. Which of the following vital sign measurements should be reported immediately? Is it A, a blood pressure of 118/78, B, a temperature of 98.6, C, a respiratory rate of 8 breaths per minute, or D, a pulse of 72 beats per minute? Do you know your vital signs? And you all do. I am so proud of you. You all know that a respiratory rate of 8 is way too low. And so the normal respiratory range is from 12 to 20. So a respiratory rate of 8 indicates that this person's in respiratory distress, and you need to get that nurse in the room right away. Question number 5. A CNA notices a red area on a resident's hip. What should you do? Is it A, apply lotion and massage the area? B, massage the area to improve circulation? C, cover the area with a warm blanket? Or D, turn the resident and report the finding? This one is so easy. I am going to come back on here tomorrow with a harder test for you all because this is way too easy for you, but it's a good refresher. And I see a lot of D's. I see one C, and the answer is D. You have it. We're going to turn that resident off of the affected limb, and we're going to report the issue to the nurse because redness on a bony area may indicate the start of a pressure ulcer. Question 6. When feeding a resident who has difficulty swallowing, the CNA should A, offer thin liquids, B, encourage the resident to eat quickly, C, tilt the head back when swallowing, or D, place food on the strong side of the mouth. Your resident is having difficulty swallowing. What do you do? All right, Geraldo and Brenda. Looks like we have A's, we have C's, we have D's. We have a lot of different options for C. And remember, if someone is having difficulty swallowing, don't get tricked because A says thin liquids. It does not say thick liquids. So if they're having difficulty swallowing, we're not going to give them something thin because they can aspirate. So anybody who gave me the answer A, give me a different answer in the chat because A is incorrect. Revealing the answer in 3, 2, and you all, we're going to put the food on the strong side of their mouth. So think about the patient who had hemiparesis, where half of their body is weak. We don't want to put the food on the part inside the part of the mouth that doesn't move. So whenever you're feeding somebody who has aspiration precautions, especially related to a stroke, you want to put the food on the side that the patient has more control, because this helps the resident chew and swallow the food more effectively, thus reducing the risk of choking. Great job, team. All right, question number 7. The CNA is performing catheter care. Which step is correct? Is it A, clean from the meatus outward? B, clean in a circular motion around the catheter? C, apply lotion to the catheter tubing? Or D, tightly secure the catheter bag to the bed frame? Which step is correct when you are providing catheter care? Naomi and Savi. Let's see, we have Faye, we have The Last Tribe, we have Charm, we have Merlin and France and Delarth. Everybody, the meatus is the the exit of the urethra. So another way of I want you to think of the urethra is the tube or the pee hole. Okay, so whenever you are cleaning the catheter, you want to clean away from the meatus. You want to clean away from the opening of the urethra, because if you do it in reverse, you'll be pushing germs into the person's urethra and they can get a UTI. So here's our rationale. The urinary meatus is the external opening of the urethra. Cleaning outward prevents bacteria from entering the urinary tract. And if you need to see a video on how to clean a catheter, we have a full playlist on YouTube that shows all of our clinical skills videos. Just go to our channel, which is youtube.com/Florida Training, and then click on the playlist and you will see the playlist with the clinical skills videos, because we need you to pass your written test and your clinical test. All right, let's go to question number 8. When should a CNA wear gloves? All right, so are you going to wear gloves when you're feeding a resident, when you're taking a resident's blood pressure, when you're providing perineal care, or when you're passing out food trays? Now, I know you want to say you're wearing gloves for all of them, but that wasn't an option. Stop wasting your facility supplies. When is it required for you to wear gloves? Revealing the answer in 3, 2, and yes, everybody, it would be C, during perineal care. That is most contaminating. So gloves are required when there is potential for contact with bodily fluids. The other times they are optional. Question number 9. A resident is choking but is still able to cough and speak. What should you do? Do you want to A, start CPR? B, perform abdominal thrust immediately? C, give the resident a glass of water? Or D, encourage the resident to keep coughing? All right, so your resident is able to cough and speak. What do we want to do? Oh, we have B's, we have C's, we have D's. All right, revealing the answer in 3, 2, and for everybody who chose D, ding, 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 you got it right, baby. If they can cough, you want to encourage them to keep coughing. All right, because that is a partial obstruction. That is not a full obstruction. So if a resident can cough or speak, they should continue to cough to clear the airway without intervention. Once they can no longer cough, that is when you do those abdominal thrusts, previously referred to as the Heimlich maneuver. And if a choking victim becomes unresponsive, that is the point at which you would do CPR. So let's backtrack. If they're coughing, encourage them to cough. Stay with them, call the nurse, cough it up, Miss Lucas, let's cough it up, just cough harder. All right, so now she's not coughing, she's not making any sounds, you're going to do those abdominal thrusts. And then after that, she stops moving on you. That means that she's lost her airway, she doesn't have enough oxygen. At that point, you're starting CPR for that patient. All right, so question number 10, team. We have 50 questions to go. All right, so question number 10. A resident tells the CNA that his roommate is stealing from him. You all, these old people are cantankerous. What should you do? Is it A, tell the resident to hide his valuables? B, inform the nurse immediately? C, accuse the roommate and demand the items back? Or D, ignore the statement unless proof is given? Yeah, that's right. I like to say some things are just above your pay grade. Let the nurse handle that. So it's going to be B. All right. You're going to report it, and you can help the resident look for the items after you've reported it to the nurse. Question number 11. When should a CNA report a resident's pain? All right, do you want to report it only if the resident asks for medication? Or B, at the end of the shift? C says when the resident appears uncomfortable? Or D, after trying to distract the resident from pain? When do you report a resident's pain? All right, I see a lot of C's. All right, looks like the C's have it. And I love this one. Yes, you all have it. Remember, not everyone can tell you they're in pain. So if you have a patient who is nonverbal, you're going to be looking for those cues. Maybe their blood pressure goes up whenever you turn them, or their heart rate or their respiratory rate increases. Maybe they're guarding an area. Maybe they're moaning. So you're going to let your nurse know that a patient is in pain or appears to be in pain whenever you notice it. Because again, some patients, especially our older patients, they'll sit there in pain for a while because they don't want to bother you or they don't want to bother the nurse. So if you see something, say something so that patient can be assessed. Question number 12. When assisting with perineal care, the CNA should, is it A, wipe from back to front, B, use the same part of the washcloth for each wipe, C, cleanse from front to back, or D, avoid using soap? What do you think, team? And you all are awesome caregivers because everybody's wiping in the right direction. That is correct. We wipe from front to back. We wipe from clean to dirty. We don't do the opposite because if we do the opposite, we put poop in a place where poop should not be. So wiping from front to back prevents bacteria from the anal area from contaminating the urethra and causing infections. Question number 13. Scenario: Mrs. Davis, an 82-year-old resident with moderate dementia, becomes visibly upset and starts pacing around the common area, wringing her hands and mumbling about needing to go home. She begins raising her voice and refuses to sit down when asked. The CNA Alex recognizes that Mrs. Davis is becoming more agitated. Remember, she has moderate dementia. So, what is the best approach that Alex can take to help calm Mrs. Davis? Is it going to be A, let's see here. Is it going to be A, ask if she wants to create TikTok videos with you to distract her? B, restrain her to prevent her from harming herself or others? C, gently redirect her attention to a calming activity such as folding towels or listening to music? Or D, leave her alone until she calms down? And while you all are giving me the answer to that one, which does not include making TikTok videos, I want to say congratulations to, all right, I don't want to mispronounce your name. I think it's Fatima or Fatmata. It says, hi, Ma. Thank you so much. I passed my exam. Thanks to you. May God continue to give you grace, Ma. I appreciate you and congratulations. All right, we're going to help some other people pass their test because with this one, the answer is C. All right, we're going to redirect her. So dementia-related agitation often stems from confusion, unmet needs, or frustration. And so you're not going to be creating TikTok videos. I don't care what you see online because that could be a violation of their confidentiality, HIPAA. And we're not going to restrain somebody just because they're confused and they're starting to act out a little bit. So try to redirect them, maybe feed them, give them something to keep their hands busy. And then after all of those attempts have failed and you still can't get them to calm down, that is when you would notify your nurse. All right, so let's go to our next one. Question number 14. A CNA is assisting with a bed bath. Which area should be washed last? Is it the perineal area, the feet, the face, or the arms? And JB, good luck on your test on Thursday. What area is washed last? I know we're torn between A and B. I see A's, I see B's. Well, we all know the face is washed first. Remember, cleanest to dirtiest. And so whenever you are given a bed bath, you would pretty much go from top to bottom. You would go from the head, switch out your washcloths as you need to, wash the front of the body, going down to the legs, and save the perineal area for last. So It is A. Great job. The perineal area is the most soiled and should be washed last to prevent cross contamination. All right, because by the time we get to the perineal area, we should never be reusing washcloths anyway or contaminating our water. But that's usually the last thing we're going to be washing because we've turned our patient. Now they're on their side. We can finish cleaning their vaginal, their rectal area, or if it's a male, their penis, their testicles, their rectum, and their buttocks. So peri area is last. Question number 15. How should a CNA respond to a resident who is having a seizure? Okay, so this patient could be thrashing about. Do you want to do A, restrain the resident to prevent injury? B, put a tongue depressor in their mouth? C, hold them down until the seizure stops? Or D, move objects away and protect their head? Oh, you were fast with this one. Yes, yes, yes. All right, waiting for about 5 more responses to come through to see if anybody has anything different. And looks like everybody chose D. Oh my God, are you proud of you? Because I'm proud of you. You all have gotten like almost every answer correct. So whenever someone's having a seizure, you want to protect them. So restraining or inserting objects in the mouth is very dangerous. The objects is going or will be the ones that's causing the injury. So if the patient's in the bed having a seizure, you put pillows, you put blankets, you put something so they don't hit the side rails. If they're on the floor, you can put a pillow under their head. If you're outside, you're not in a hospital setting, you can put a bag, a purse, just put something under their head so they don't hit their head on the hard ground. And then when they get through having their seizure, we usually put them in the recovery position, which is a sideline position, because after a seizure, a person could vomit, and we don't want them to vomit while they're flat on their back. That could make them aspirate. And in all of this, don't forget you've screamed out for your nurse, and she is coming. So she'll be there as soon as she can get there. Question number 16. What should a CNA do first if a resident falls? Is it A, pick the resident up immediately? B, move the resident to bed quickly? C, ignore minor falls if the resident says they are fine? Or D, ask if they are hurt and report it to the nurse? And Jody, I don't know what PSW means, so if you'll put that in the chat and I'll be able to answer your question. All right, everybody, revealing the answer in 3, 2, and that is right. Don't get that patient up. You keep them on that floor. You monitor them. You don't leave them. And when that nurse comes, that nurse can help you get that patient up off the floor. So the answer is D. A CNA, you can be checking for injuries while you're waiting for the nurse, but don't get them up. Don't move them too much. Keep them calm. And when the nurse gets there, we'll do a team lift, get them back to bed. And that's when we can do our assessment and our vital signs. Question number 17. If a resident is on oxygen therapy, what safety measure should the CNA follow? A, remove oxygen when the resident is sleeping. B, keep the oxygen tank close to heat sources. C, ensure there are no open flames nearby. Or D, allow smoking in the resident's room. And then I'm going to put our email address in here, Evie, because they have terms that are specific to different areas or different countries, and I don't know what a personal support worker is. So just send me an email. I'm putting it in the chat now, and I will have my office manager research that. All right, so here we go. It's in the chat. All right, so if someone's on oxygen, what safety measure do you want to follow? And it looks like everybody has it right. That's right. We cannot have oxygen near any open flames. So they should not be smoking in their rooms if they have oxygen, because oxygen is highly flammable. And so open flames and smoking must be avoided to decrease the risk of a fire hazard. Question number 18. How often should a resident be repositioned to prevent pressure ulcers? And this is so easy. We're just going to go ahead and give you the answer right now. Of course, it's going to be every 2 hours or more often if the patient complains of pain. So if you turn your patient in after hour 1, they're saying, hey, my leg hurts, my hip hurts, my arm hurts. Don't leave them in that position for another hour. Just go ahead and reposition them right then. So we're going to change it every 2 hours and more frequently if the patient complains of discomfort. Question number 19. The first step in the fire response response procedure, RACE, is it A, extinguish the fire, B, call the fire department, C, remove residents from danger, or D, close all doors? I'm doing my nurse dance over here. That's right, Sherry and Merlan and Julie. I'm going to mess up the names because I'm tired tonight. So I'm not even going to do that to you. But yes, it is C. We're going to rescue first. That is the R. So RACE stands for rescue, alarm, contain, and extinguish. And remember, if you can't extinguish that fire, the E could also stand for exit the building, but the resident safety comes first. So always rescue your patient first. All right, question 20. We have another scenario. Mr. Johnson, a resident with swallowing difficulties, has been placed on a pureed diet to ensure his safety while eating. As his CNA prepares his meal tray, she must ensure that all foods are appropriate for his dietary needs. Which of the following options is safest for Mr. Johnson to eat? Remember what his diet was. So are we going to give him A, raw carrot sticks, B, steak slices, C, smooth mashed potatoes, or D, hard bread rolls? Excuse me. And you all have it. And whenever you're feeding somebody a parade tray, don't frown. There's no reason for you to frown. Like, oh, yeah, this looks interesting. Yeah, look, it's going to taste the same. So the mashed potatoes that are pureed, and then the green beans that are pureed. Now, don't start mixing random foods together. Like if they have beets and sweet potatoes, don't start making a rainbow. Put like foods, put the foods you would eat together on that patient's spoon. But a parade diet consists of soft, smooth foods that require little to no chewing and are easy to swallow. So you make sure that your patients with swallowing difficulties get the right tray, limit distractions, make sure they're sitting upright, and feed them with a smile on your face. All right, so question number 21. When recording a resident's intake and output, we also call that I&O. The CNA should A, estimate the amount of fluids consumed, B, measure fluids in cubic inches, C, only record fluids given by mouth, or D, record fluids in milliliters, also referred to as mLs. All right, I'll give you a few more seconds to think about this one. And we'll reveal the answer in 3, 2, and you all are phenomenal. It is D, because your patient could have multiple, even some of your hospitals, you are documenting flushes and everything else. So it's just not what they take in orally. So we're going to record it in milliliters or mLs. And the rationale is that intake and output must be recorded for accuracy, including fluids given orally through IVs or enteral feeding tubes. And now I have a bigger image on the next slide, so I want to show this to you. And so let's say that for your, this would not be enough fluid for a 12-hour shift. So we'll say this is what the patient consumed for breakfast and for lunch. So they had 200 mLs of water. Looks like they had 360 mLs of maybe like chocolate milk or something because it's brown. And then they had another 140 mLs of water or juice. So they had 700 mLs total. That is not a lot of fluid, but they only had 80 mLs or 80 cc's of urine out. So that means your patient had a total fluid intake of 620 mLs, or that they are retaining fluid. So I want you to be careful. If it doesn't match, if what goes in doesn't match what's coming out, you should let your nurse know. So if I saw this, I'd be like, hey, are you having any problems? Do you want to go to the bathroom again? Because if you had 700 mLs of fluid, that's almost a whole liter. I need to see more than just 80 mLs of urine. So keep that in mind. When in doubt, don't forget that you're part of a team and ask your nurse for assistance. Oh, I did. You did your exam the day you forgot your ID. They let you take your test. Well, good luck, Marvelous. All right. So, question number 22, you all. A resident with diabetes is shaking and sweating. The CNA should A, give them candy, B, report it to the nurse, C, have them rest and check again later, or D, offer more insulin. I know y'all want to give them candy, but nope, you can't give them anything sweet until the nurse tells you to do so. So the answer is going to be B. And based on how that patient is presenting, based on how low their sugar is, the nurse will tell you what you need to get that patient. Question number 23. When emptying a urinary drainage bag, the CNA should A, disconnect the catheter to drain it faster, B, empty the bag once a day, C, measure the output before disposing of it, or D, keep the bag higher than the bladder. Well, Marvelous, we're still praying for you, dear. And next time we're going to remember that ID. I know you got there on time. It's a lot to remember, but they will never get you like that again. And then someone asked, what skills did you have on your test? Marvelous. All right, so you all are emptying that drainage bag. What do you want to do? And everyone is saying C. Let me tell you, that is a way they get you on your skills test. If you are nervous and you pour the urine out before you measure it, you have to bend down, eye contact on a flat surface. Your nurse needs to see the number also. So slow down. Don't just get your number, try to start reading it in the air when the urine is still moving in the graduated container. Slow down, say it on the surface. It can't go directly on the surface, it has to go on the napkin. Measure it, make sure your nurse sees it, and then pour it out and clean out your container. So it should always be measured and documented before disposal. And when you're taking your test, for most states, this is also a skill that will be testable for your CNA examination. And we do have our skills videos, don't forget that. So if you didn't understand anything I just said, go watch our videos in our CNA skills playlist. All right, so a CNA notices that a resident with a a sight impairment has difficulty seeing their food. What are you going to do? So Miss Lucas, she can't see what's on her plate. Are you going to do A, describe the food using the clock method? B, feed the resident immediately? C, move the plate closer to the resident's chest? Or D, avoid serving hot foods? Game, Marklyn, Judy, Diana, Sherry, Chrissy, Charm, May. I'm so proud of you. Amina, Jody. Yes, we're going to use the clock pattern. So it is A. The clock method helps visually impaired residents locate food on their plate independently. We don't have to feed our visually impaired patients if we can talk them through feeding themselves. And so here we have an image. Looks like they have eggs at 12 o'clock. They have, I don't think this goes together, beans at 3 o'clock. They have their toast at 6 and then some meat over at 9. Make sure their hands are clean, they're sitting upright, and the towels on their chest or a clothing protector allow them to touch the food that's on their plate with their clean hands. And then make sure they know what their drink is so they don't spill it. Give them a spoon. And if they make a mess, it is okay because you're going to encourage independence. And you can always come back in there and clean it up whenever they have finished feeding themselves. So we assist our sight impaired patients. They are usually not total care. So we're going to talk them through the process. All right, question 25. Merlin, I don't know if that's true. I'm not getting in trouble. All right, so question 25. If a resident starts to fall while walking, all right, you're walking Miss Lucas and she's starting to slip, you all, what do you do? A, hold them up to prevent the fall. B, grab their arm tightly to keep them steady. C, ease them to the ground while protecting their head. D, call for help and let them fall naturally. We have another person who passed their test. Congratulations, May. And you all, I'm sure some others have passed their test too, and I didn't see everybody's comment, but I am so proud of you all, our future nurses in the making. All right, so everybody, question number 25. The answer is it is C. So we're not going to allow them to fall. It's called an assist. We're going to pull them back towards us. We're going to kick our leg out between their leg, and we're going to allow them to slide down our leg onto the floor while trying to control their head. And you don't want to just sit them up on the floor without you having your hands on them. The best thing to do would be to lay them down, because if they're dizzy and they're sitting up and you're unable to control them, they're just going to fall over anyway. And now they can actually injure their head. So you slide them to the floor while you're screaming out for help. And we're going to come running to you and help get that patient off the floor, so you won't be there with that patient too long by yourself. All right, so question number 26. A CNA should report which of the following immediately? Is it going to be A, resident who refuses to shower, B, a resident who slept late, C, a resident who requested a different meal, or D, a resident who has slurred speech and weakness? And so, Mathai, it doesn't matter whether it's a nursing home or a hospital, the physician always authorizes discharges. Sometimes the patient may want to leave without the approval of the physician. And so we call that going against medical advice. But a discharge has to be approved by a physician. All right, so everybody, question number 26. The answer is D. So remember that whenever you suspect someone is having a stroke, you want to think fast. F, you're going to look at their face to see if it's drooping. A, you're going to ask them to raise their arm, and one arm may not raise as high as the other. S, you're going to ask them to speak, and you will find out that their speech is slurred. T, if you're in the hospital, it's time to call that code. If you're not in the hospital, it is time to call 911. So whenever someone's having a stroke, I need you to think fast. Face, arm, speech, time to call. Question number 27. Which of the following is a sign of dehydration? And we know when our elderly patients get dehydrated, they end up getting UTIs. So we need to prevent dehydration. But what is a sign of dehydration? Is it increased appetite, clear urine, excessive sweating, or dry mouth and confusion? All right. Miss Lucas is seeing bugs on the wall that are not really there. She's starting to act strange. This is not her. We're immediately thinking UTI, which is more than likely caused by dehydration. It is D. Great job, everybody. So if your patient's not drinking anything, their skin is going to get dry and their lips are going to be chapped. So dehydration includes dry mouth, confusion, and dark urine. When you start seeing the urine changes, that should be an indicator to increase those fluids and to let your nurse know that there has been a change in the urine color. Concentrated urine is usually a sign of dehydration. Question number 28. A CNA notices bruises on a resident's arm. The resident says their caregiver is rough. The CNA should A, ignore it unless the resident says it again. B, tell the caregiver to be more gentle. C, report the suspected abuse immediately. Or D, wait to see if more bruises appear. And if you didn't know, once you have your license, you are a mandatory reporter. So as a mandatory reporter, we don't wait to see if it's going to improve or if it's going to get worse. You just report what you find, and then the nurse and the case manager will take it from there. So it is C. You need to report the abuse immediately, the suspected abuse. Even if you're wrong, it's okay. No one's going to get in trouble if you are wrong. We just need to find out why this patient has these bruises, and or maybe the caregiver needs more training so that she won't be as rough when she's caring for that patient. What, Miss Felicia? Congratulations, baby. All right. And so we still have more questions to go. But if you have been here this long and you haven't liked this video, you haven't shared this video, haven't subscribed to the channel, come on, do a nurse a favor and go ahead and do so now. I appreciate you all and I love being here with you. But go ahead and subscribe to our channel. We're trying to have 1 million subscribers by summer and we're almost at 900,000. So with you, we can do it. All right, question number 29. Before assisting a resident into a wheelchair, what should you do? Oh, this one's too easy. We did this one already. It's going to be lock the brakes, right? So we're going straight through that one. Question number 30. After calling for the nurse, what should a CNA do if they notice a resident is having trouble breathing? Look, you all, it's going to take me 2 minutes to get into that room. So while you're waiting for me to get into that room, I need you to do more than just look at that patient. So is it going to be A, leave the room to get help, B, give the resident water, C, increase the flow of oxygen, or D, adjust the resident's head for easier breathing? And the crowd goes, wow, because everybody knows that we have to sit that resident up. It is D. Let's reposition them so they can breathe better. So positioning a resident properly can improve airflow while waiting for further medical intervention. Remember that oxygen is a drug and CNAs are not allowed to give drugs. So therefore, you cannot adjust the flow of the oxygen. Only the nurse or the respiratory therapist can do that. If the tubing has become disconnected, you can reconnect the tubing, but you don't adjust the flow. Question number 31. When assisting a resident with ambulation using a cane, the CNA should instruct the resident to A, hold the cane on their weak side, B, hold the cane on their strong side, C, move the cane and strong leg together, D, keep the cane close to the body and not move it. All right, so Mrs. Lucas has hemiparesis, but she has a cane. What side should she hold that cane on? Revealing the answer in 3, 2, and I'm so proud of you. You all have it. Yes. How can she hold the cane with her weak side? It's going to have to be her strong side. Because if she's had a stroke on the side, you support that side. You support the weak side. She's going to hold that cane with her strong side. So the cane provides support for the weaker side. So it should be held on the strong side to assist in balance. And so let's see. Yep. Felicia, I can't wait for you to be prepared for your NCLEX. Yes, I look forward to meeting you. All right, question 32. A CNA enters a resident's room and finds them crying. What is the best response? Is it A, don't cry, everything will be okay? B, let's get your mind off it with a fun activity? C, I'll give you some time alone to calm down? Or D, would you like to talk about what's bothering you? Remember, communication is very important. You're sometimes one of the only people that patient will see, especially in home care. So what is the correct response? And yes, it is D. So we're going to encourage open communication. Remember, as a CNA, when you're communicating, it's not about you talking. It's about you being available to listen. So you're going to show empathy and emotional support while you're listening to this resident. Question number 33. They have another scenario here. Mrs. Lewis, a resident with dysphagia, receives nutrition through a gastronomy tube or a G tube. That's a tube going directly into her stomach. While providing care, the CNA notices that he is lying completely flat in bed during the feeding. Understanding the risk of aspiration and proper positioning for tube-fed residents, what action does the CNA take? And I have more information on the next slide. All right, so let's go to the next slide, you all. All right, so what is the best step the CNA should take to ensure Mr. Lewis's safety during his feeding? Do you want to do A, keep the head of the bed at least 30 to 45 degrees, B, keep the head of the bed at least 60 to 90 degrees, C, stop the feeding if the resident coughs, Or D, lay the resident flat after the feeding. Remember, the tube is in the stomach. The food is going directly through the stomach. It is bypassing the normal route of digestion. So they're getting food directly into their stomach and they're laying flat. All right, let's see what answers we have. Nene, you can do it, girl. You got this. Don't put it off anymore. All right, everybody, revealing the answer in 3, 2, and we have a lot of A's and a lot of B's, and now we have some C's. And so, anytime a patient has a tube feeding, they should not be laid flat without you pausing that tube feeding, because that food can travel up, right up into the esophagus, and then whenever we sit them up, it can go down into the trachea and enter their airway. They can get pneumonia. So we're always going to keep that head of the bed at 30 to 45 degrees. They are semi-upright. They are not all the way upright. Let me tell you why. Because if we have a patient sitting up on their butt 60 to 90 degrees all day, every day, they're going to get a pressure sore. So your patients who have those gastric tubes with feedings going through will be in a reclining position, not a flat position, not an upright position for too long, because again, if they're flat, they can aspirate. If you sit them up to 90 degrees, they're going to get a sore on their butt. So this is the best position for them. All right. And if you do need to lay them flat, to give them a bath, or to change their linens, just make sure you pause that tube feeding first and just check with your nurse. All right, question 34. The best way to communicate with a hearing impaired resident is to A, speak loudly and exaggerate lip movements, B, stand behind them while talking, C, face them directly and speak clearly, and D, use hand gestures only. Miss Bonita, it's okay. You got one wrong. You gonna be okay. And yes, for everybody who's choosing C, whenever we have somebody who's hearing impaired, we need to be facing them because they usually read lips. So it's going to be C. Face the resident directly. That allows them to read your lips and better understand the conversation. And for any of you all who find that hearing me read the questions to you, it just helps you to understand and answer the questions better. Don't forget that when you go and you take your CNA examination, you can ask for an oral examination. The computer will read the questions to you. At the end of the day, I just need you to pass this test. It doesn't matter what resources you use to pass the test, but most of the testing agencies will let you pay for an audio examination. The computer will read the questions and the answers, and that will help you pass your test on your first attempt. All right, let's keep going, everybody. We're on question number 35. What should a CNA do when cleaning dentures? All right, so are we going to use hot water to kill the germs? Are we going to do B, hold them firmly over a hard surface? C, brush them with toothpaste? Or D, place a towel in the sink to prevent breakage? Yeah, and you all have it. You have it. All right, we're not going to use hot water because hot water is going to reshape the dentures and it can cause damage. You use warm water or cool water, but not hot water. You don't want to hold them firmly over a hard surface because they could drop out your hands and you could break the dentures, and then you got to pay for these dentures that you've broken. And we don't use toothpaste, we use denture paste. So process of elimination, the answer is D. That is right. That is right. Woo-hoo-hoo. Our next question, everybody, question number 36. We're getting there. Question 36. A resident with a colostomy should have their bag emptied when? So we have that opening. We have that protrusion. And for whatever reason, right now, my brain is just not there. Stoma, there we go. And so now their fecal matter is being collected in the bag. When do you empty it? Is it going to be A, when it is completely full, B, when it's 1/3 to 1/2 full, C, when the resident requested, or D, once per shift? How often do you empty a colostomy bag? I see A's, B's, and C's. Now I see a D. Oh, I got every letter this time. All right, and so You're not wrong if you chose once per shift. But let's say that this person's bag is full before the end of your shift or half full. Don't wait to the end of your shift because we don't need that fecal matter backing up and irritating the patient's skin. So the answer is going to be B. If it is, I say for most things, once it's half full, it's time for you to empty it. So emptying the bag before it gets too full prevents leakage and discomfort. And sometimes it may not be full with fecal matter. Sometimes it could be full with gas and you have to burp it. And when you burp it with compassion because you're not the one left in the room smelling those, that smell from that colostomy bag. So don't go in there being all extra wearing a mask when this patient doesn't have a respiratory infection. Just deal with it. Most of your facilities, they may have like an orange spray that you can use to kind of tame the smell. But remember, that patient's the one who's left in there with that smell. So you can get over yourself for a few moments, go burp that bag. Otherwise, that patient has a whole bunch of air trapped in the bag, which means it's actually backing up into their intestines and causing cramping. So have compassion when you're taking care of somebody with a colostomy. It's not about you. All right, question number 37. A resident who has difficulty swallowing should be placed in which position during meals? Is it A, high Fowler's, B, supine, C, side lying, or D, Trendelenburg? I'm doing my happy dance. I'm doing my happy dance. That's right. Dudley Nicole and France and Faye and Carmina and Stacy Anna and Mark Klein. It is the high Fowler's position. We're going to sit them upright to reduce the risk of aspiration. Question number 38. All right, we got vital signs again. So Mrs. Reynolds, a 78-year-old resident in a long-term care facility, has been feeling dizzy and weak throughout the morning. As the CNA checks her vital signs, the readings are as follows. The blood pressure is 88 over 54 millimeters of mercury. The heart rate is 112. The respiratory rate is 22. And the temperature is 97.8. Patricia, that is a great question. I probably need to do a video on how to burp a colostomy bag. But you can, it depends on the wafer. It depends on the actual device. But that's a good question. I'll try to get a video out on that one. So it just depends on how the bag is set up. You can unclamp it or you can just release the wafer a little bit and then press it back down and resecure it. All right, so question 38, you all. We have some abnormal vital signs. And so let's repeat that. Our blood pressure is 88 or 54. Our heart rate is 112. Respiratory rate is 22. Temperature is 97.8. So the only thing there that is normal is the temperature. Everything else is not normal or abnormal. And so now that you have recognized the findings, what is the best action for the CNA to take? Are we going to do A, encourage the resident to rest and recheck her vital signs in an hour? B, assist the resident into a standing position to improve circulation? C, immediately report the findings to the nurse and keep the resident in a safe position? Or D, offer the resident a glass of water and encourage her to walk to increase her heart rate? Our heart rate was 112. It's increased enough. And so, if you chose, that is right, May and Cecilia and Mark Klein and Zenby. Yes, that is right. Babe, we need to get the nurse in that room. Get the nurse in the room right away. Let's go back and look at those vital signs. So 88 over 54, we're not standing her up. Her blood pressure is low. If we stand her up, it's going to go lower. Heart rate's 112. So why is the blood pressure low and the heart rate 112? Because the heart is trying to compensate for the low blood pressure. It's just pumping, but ain't enough fluid in there. So maybe right now the patient's dehydrated. And then a respiratory rate of 22 is marginal. Maybe she's anxious, but it still needs to be reported. So the answer is C. The low blood pressures, we call that hypotension, and the increased heart rate, we call that tachycardia, suggest a potential issue such as dehydration or blood loss. And both of those conditions require further evaluation. As a CNA, you don't diagnose. You report what you find, you let your nurse know, your nurse will go and assess, and then he or she will then call the doctor who diagnoses the patient. Question 39. This one I got wrong. The purpose of range of motion exercises is it A, strengthen the resident's muscles, B, make the resident more dependent, C, increase the resident's weight, or D, reduce the risk of contractures? Man, y'all smarter than me. Y'all got the answer right. All right. So I see I tricked a few of you all. So everybody, the answer is not A. I thought it was A too. It is not A. So give me another option if it's not A. Remember, range of motion impacts, stop laughing at me. It impacts the joints. So it's not about muscle. So it's not improving muscle strength. So it is D, everybody. It reduces the risk of contractures or that fixation of the joint. All right, so range of motion exercises prevent stiffness and maintain flexibility in the joints. ROM exercises are primarily designed to maintain joint flexibility and prevent stiffness, not to build muscle strength. Okay. All right. Question number 40. Another scenario. Mr. Carter, a 65-year-old resident with a history of chronic obstructive pulmonary disease, COPD, is experiencing increased shortness of breath and appears anxious. As the CNA checks on him, they notice the following. The respiratory rate is 28. The O2 sat is 89% on room air. The skin color, slightly bluish. We call that cyanosis. So he has a bluish lips. And then it says posture. He is sitting forward using those accessory muscles to breathe. So he's having a hard time breathing. All right, so let's see what our question is. All right, so what do you do first as the CNA giving those vital signs? Is it A, encourage Mr. Carter to take slow, deep breaths while laying flat to relax? B, ask Mr. Carter to breathe faster to improve his oxygenation? C, obtain another oxygen saturation reading in 15 minutes to confirm the result? Or D, elevate the head of the bed and report the findings to the nurse immediately? This is so easy. Oh my God. I should have read this one better. I could have made it harder for you because you know that anytime someone has a respiratory issue, we're setting them up and we're calling a nurse. So y'all not get me like this tomorrow. I'm gonna make these questions hard. So question 40, the answer is D. Remember, signs of respiratory distress include the increased respiratory rate, the cyanosis or turning blue, and the use of the accessory muscles, the abdominal muscles. And that could indicate worsening COPD, and it requires prompt intervention. Now, what some people forget is that African American people, dark skinned Hispanic people, dark skinned Asian people, we don't turn blue. So, whenever you start thinking about cyanosis or someone turning blue, remember that for some populations, turning pale is a sign of poor circulation. So if your patient's coloration has changed, it doesn't have to be blue. I need for you to get that nurse in the room right away, okay? Because if you're waiting for me to turn blue and you didn't give me any blueberries, it's going to be a while. Meanwhile, my O2 sat will be 70 and you're like, oh, well, she didn't turn blue, so there's no way she's struggling. So make sure you check on your brown people. We don't turn blue. Look for changes in skin coloration, a pale or like a grayish color. All right, question number 41. A resident's urinary output is low. And the CNA should, is it A, report it to the nurse, B, increase their fluid intake without asking, C, ignore it unless the resident complains, or D, stop recording the output? So your patient isn't producing any urine. What are you going to do? That is right. Report it to the nurse because it could be kidney failure. It may not just be dehydration. So, low urine output could indicate dehydration or kidney issues, and it needs to be reported. Question number 42. Which of the following is an example of proper body mechanics? Remember, we need you to be caregivers for a long time. So, take care of your body, raise that bed, do all the things you're supposed to do. Wear good shoes, wear those Ted hose. All right. And so, is it going to be A, keeping feet close together while lifting, B, bending at the waist to lift a heavy object, C, using leg muscles when lifting, or D, twisting the body when turning a patient. Yeah, great body mechanics, everybody. You have it right. It is C. We're going to use those leg muscles, those strong muscles. So the first image, I have the X there. That's incorrect. Do not use your back because you're going to hurt yourself. Whenever you're trying to pick up a patient, you're picking up something heavy. You want to use those strong leg muscles and your arm muscles, okay? And try to have patients pulling on you when you're getting them in and out of the bed because they can be pulling on your shoulders and that can cause back pain also. Question 43. Mr. Jackson, a 76-year-old resident, has a urinary catheter in place. During routine care, the CNA notices that the catheter bag is nearly empty, even though Mr. Jackson has been drinking fluids throughout the day. He also complains of discomfort and feeling a fullness in his lower abdomen. All right, so there's Mr. Jackson. What should the CNA suspect and do next? Is it A, the resident is dehydrated and encourage him to drink more fluids and monitor his output? B, the catheter bag is faulty, empty and replace the bag, then reassess in an hour? Is it C, the resident may be experiencing urinary retention, check for kinks in the catheter tubing and report the findings to the nurse? Or is it D, the resident may have a bladder infection, massage his lower abdomen to encourage urine flow? Miss Love, Child of God. Hey, yes, it is C. And Lois and Helen and Sandy and Fatima and Carmina and Stacy Anna. It is C, you all. Look, if they have a catheter, they should be producing some urine. So if there's no urine in that bag, I need for you to troubleshoot. And whenever you troubleshoot, you start with the patient, not with the bag at the bottom of the bed. So start with the patient, look at his genitals, and then trace that line to make sure it's not kinked, it's not clogged. Sometimes they can have mucus, they can have sediment in the tubing. And so if you see something abnormal, of course, report it. And of course, if there's a blood clot or something, that's going to be obvious. You let the nurse know. But urinary retention can occur when the bladder does not empty completely, even with the catheter in place. And so a nearly empty catheter bag, despite adequate fluid intake and complaints of fullness and discomfort suggests urinary retention or a catheter blockage. Check for kinks or obstructions and ensure the urine can drain properly before escalating the issue to the nurse. So you check first, and after you do your check, you can't figure it out. That's when you tell the nurse. Question 44. Which of the following best describes objective data? Is it A, the resident says they feel tired? B, a resident reports a headache? C, a resident has a temperature of 101 degrees Fahrenheit? Or D, a resident complains of stomach pain? Which is objective data? Let's see if I missed any comments. And I'm good, I haven't. Okay. Oh, this one we're a little bit slower with. I know subjective, objective. What is the difference? So 44, everybody. Answer is C. So objective data is measurable, it's observable, and factual. It is information that can be collected through assessment tools, medical instruments, or direct observation versus subjective data that is based on personal perceptions, feelings, or statements from the resident. So if the resident says, I feel hot, that is subjective. But if you take their temperature and their temperature is 101, well, now that would be objective. And so we know that the reason why this patient feels hot is because they are febrile. They have an elevated temperature. All right, so Mr. Anderson, a 78-year-old resident, has a stage 4 pressure ulcer on his left hip. The CNA is assisting with repositioning to prevent further skin breakdown and promote healing. So we have a 78-year-old. They already have a pressure sore on their hip from being in position for too long. Stage 4 means that that sore is now down to the muscle and the bone. So this is a really bad pressure sore. All right, so which of the following is the best way for the CNA to reposition Mr. Anderson? Are you going to do A, place him on his left side with a pillow under his hip to relieve pressure on the wound? Is it B, reposition him onto his right side or back using pillows to offload pressure from the left hip? C, keep him in the same position to avoid disturbing the wound and dressings? Or D, assist him into a prone face down position to distribute weight evenly? All right. So this patient already has a pressure sore on one hip. He has a pressure sore on his left hip. What are your um, options for repositioning? And I'm so proud of you all. I am so proud. You got to see I would let you see my face, but I'd scare you. It's been a long day. But yes, you're absolutely right. We cannot put him back on the left. So the answer is going to be B. We can turn him to his right side. We can reposition him on his back. So stage 4 pressure ulcers involve deep tissue damage extending into the muscle and the bone. And so placing pressure directly on that left hip can worsen the ulcer, delay healing, and increase pain. So a person who has an ulcer on one leg, we're probably not going to turn them towards the ulcer. So what we're going to do instead is we're going to frequently reposition them every 2 hours, but we're going to position them away from the affected extremity or the affected limb. So, and Vanessa has a test date on March 6th. It looks like Marvelous has only missed 5 so far, so great job. All right, we have 4 more to go. All right, question 46. Mr. Thompson, an 86-year-old resident, suddenly complains of chest pain while sitting in his chair. The CNA immediately notifies the nurse. While waiting for the nurse to arrive, what should the CNA do? Is it going to be A, give the resident a glass of water to help them feel more comfortable? B, massage the resident's chest to see if the pain goes away? C, stay with the resident, keep them calm, and monitor their condition? Or D, ignore it if the pain seems mild as the nurse is on the way? Patient with chest pain, and you're in the room with them for the 2 minutes until the nurse gets there. Let's see what I missed. And you all have it. That is right. You're going to stay right there with that patient because chest pain can be a life-threatening condition. It can actually indicate a patient's having a heart attack. But when someone has a really severe heart attack, they can go into cardiac arrest, meaning that their heart stops. So you need to start CPR. So you don't leave that resident. You stay there. You reassure them. You let them know that that nurse is coming. So encouraging a resident to stay calm and limiting movement can help reduce strain. And you don't want to give them anything to drink or anything to eat, even if they may be asking for just a sip of water, because more than likely they're about to go to surgery. And we cannot put it like this: fluids, oral intake, and sedation don't mix. The person can vomit on the table and aspirate. So immediately they're NPO, the nurse will get in the room, we'll get an EKG, and we'll hopefully get that patient to the cath lab. All right, so question number 47. CNA sees a spill in the hallway. What should they do? Is it A, report it, but let housekeeping handle it? B, walk around it and warn others, hey, y'all, be careful, it's a spill right there? C, clean it up immediately? Or D, ignore it unless someone slips? So there's a spill in the hallway. All right, I couldn't trick you all on that one. Y'all didn't want to just wait until housekeeping came. You all are being phenomenal CNAs. I love it. That is right, baby. It's a team. You can't wait for housekeeping. I need for you to put on some gloves, get a towel, and to clean it up. We're going to prevent that fall. And then chances are, you know who going to fall? It's going to be Nurse Eunice, because I ain't going to be paying no attention. I'm just walking through and I fell on the floor, and now you got to take care of me. You got extra patience. So prevent me from falling, clean up the water, and then if there's like a smear or something there, the environmental services department can clean that smear. But remember, you don't want to overwork them. There may only be 1 or 2 environmental workers on your floor with like 60 beds. So if there is water actively on the floor, I need for you to take care of it, okay? We're responsible for each other. Yes, ma'am, no falling. Question 48. A CNA finds a resident in bed with no pulse or breathing. After calling the nurse, what should a CNA do? A, start CPR immediately if allowed by facility policy. B, call the resident's family. C, move the resident to a comfortable position. D, wait for the nurse to arrive. Right? No breathing, no pulse. Nurse is coming. You're in room 1, she's in room 30. She's getting there as fast as she can. What do you do while you're waiting for her to get there? Oh, I see some A's. I see a lot of A's. Yes, that is it. So we're going to start CPR immediately if allowed by facility policy. And the reason why I put that there is because you all remember hospice patients, they won't, if you're in a hospice facility, they may not allow you to perform CPR because the patients there have a DNR order, do not resuscitate order. So make sure you know your patient's code status. That's number one. Okay, when you get your report, you should know what type of resuscitative measures your patients want. And if it's a patient who is a full code or a limited code and they're pulseless and they're not breathing, you're going to call for nurse. You're going to start CPR. And when the nurse gets in the room, she can take over the efforts and or assist you. Question number 49. When applying a restraint, the CNA should A, tie the restraint to the bed rails, B, secure the restraint tightly to prevent movement, C, ensure the restraint is loose enough for 2 fingers to fit underneath, or D, use restraints whenever a resident is restless. And I am so proud of you. You all did so well with this practice test. I'm like thinking that maybe like most of you all missed 3 questions. I hope you're as proud of you as I am of you because that is freaking awesome. Hold up. I see another success story. Where did it go? Whoop, whoop. All right, U.S. investment in past my, that's a long word, on Sunday. Thank you, ma'am, for your support and guidance. You are so welcome, and I am so proud of you. Congratulations. And so, everybody, anytime we're putting a restraint or anything on a patient, it could be a dressing. You want to try to slip 2 fingers between the device and the patient. That ensures there's enough room for circulation. So if we put anything on a patient and we can't put 2 fingers between it, that is too tight. You're cutting off circulation. You're cutting off blood flow. So restraints, your facilities will teach you how to apply them, how to do the slip knots, etc. And remember, a restraint should never be attached to a side rail because if you attach it to a side rail, whenever that rail lowers, it can also pull on that patient's extremity and dislocate that extremity. So where are the restraints actually connected to? It's connected to the non-movable frame of the bed. There's just like little hooks, little holes, and that's where we connect our restraints. We're on our last question, team, and I am so proud of you. Look at her. Ooh, she is feisty. So Mrs. Carter, a 78-year-old resident who is continent, that means that she can control her bladder and her bowels. She does not have any noticeable odor. She politely refuses her scheduled bath and she states, I don't see why I need one today. All right, so that's the scenario. She hasn't peed on herself, she hasn't pooped on herself, and she doesn't smell, and she don't want a bath. What do you do? Is it A, insist that she take the bath since it's part of her care plan? B, ignore her refusal and move on to the next task? C, respect her decision, skip the bath and document that she refused? D, acknowledge her concerns, encourage hygiene, and report the refusal to the nurse? I see C's. I see a lot of C's. So y'all not gonna let the nurse know? I know it's like it should be a mix between C and D. I understand that, but all right. So let me tell you what these wonderful patients are going to do. She is going to refuse that bath, and all you did was document it. You never let the nurse know, and so the nurse cannot protect you because you didn't tell her. All right, and so you documented it, but now when the next shift comes, she's going to be like, "They ain't never give me no bath. They ain't never offer me one," and y'all know you about to get that nurse in trouble because you didn't even communicate that there was an issue. So let your nurse be made aware. And the nurse is probably going to be like, okay, we'll see if she wants one next shift. But don't forget that when we're giving these patients their baths, it's not because they have a body odor. It's not because they have pooped or they have peed. We need to do a skin assessment. We need to make sure there's no broken or open areas on her body and no signs of a pressure sore. So that is another reason to give a person a bath, whether, they want one or not, but maybe your nurse can at least go in and get a skin assessment since you couldn't do so. And so you all, I am so proud of you. I do want to let you all know that the reason why I've not been online is because I lost a very dear nurse buddy. And so this video is in loving memory of Janita. Janita and I have been friends for 26 years. We started our nursing journeys together, and she was a manager at Fresenius, a dialysis clinic. She owned Scrub Central. So just a very wonderful person all around. And she died about 2 weeks ago, and life has not been as fun without my girl around. So I hope that you one day can also find you some nurse buddies, some CNA buddies to grow young with. And so rest in peace, dear friend. Your impact will always be felt in the nursing community. You are forever in our hearts and nursing strong. And you all, we are stronger together. I don't care about this crazy political stuff that's going on. I need for us to work together to save patients' lives. And I love you and I appreciate you. And if God says so, if you give me just a little bit of a break, I'm going to be back on here tomorrow. So I love you. Have a good night, everybody, and good luck on your test.